Tough new ads from an independent outside political group make a serious claim.
They say that hundreds of thousands of Minnesotans could lose their health insurance if Republican Jeff Johnson becomes governor. Is that true? Here's Pat Kessler's reality check.
The ads from the Alliance for a Better Minnesota feature Louise.
I was diagnosed with cervical cancer in 2015.
And Stacy.
If Jeff Johnson were governor, our family would be devastated.
But this claim caught our attention.
300,000 Minnesotans will lose their health insurance under Jeff Johnson, and insurance companies could deny coverage for those with pre-existing conditions.
Jeff Johnson calls that a blatant lie. In this new ad, he promises coverage for pre-existing conditions.
I see a much brighter future for Minnesota, where we lower health care costs with competition and choice.
Both of these claims cannot be true, right? Pre-existing conditions are either covered or they are not. Well, here's what we know.
Johnson promises to seek federal permission to quit Obamacare in Minnesota, bring back a state high-risk pool covering patients with pre-existing conditions, and allow out-of-state insurance companies to sell policies in Minnesota. Healthcare experts say that could have unintended consequences. The Minnesota Health Department, the Congressional Budget Office, and the Kaiser Family Foundation agree. Monthly premiums for healthy people could drop, but premiums for sick people could rise up to 25%, causing up to 300,000 people to drop insurance. And insurance companies would not cover all pre-existing conditions. So when the ad claims
300,000 Minnesotans will lose their health insurance under Jeff Johnson,
that estimate is high, but it's possible many people could drop coverage. And this?
and insurance companies could deny coverage for those with pre-existing conditions.
Healthcare experts say that's true. That's Reality Check.
Johnson will face DFL candidate Tim Walz on Election Day. Both have about $1 million in their campaign war chest.